of your background, where you kind of transitioned to being more of a functional integrative practitioner, and what exactly that means? Because I think that's something that seems to be picking up steam in the alternative health community, and you hear it thrown around a little bit as a buzzword these days, but it's still vastly missing from the mainstream. So maybe how did you come to learn that? What does that mean to you?
Sure. Well, I went to medical school at the Technion Faculty of Medicine in Israel, and after medical school, I did a year of internship at Staten Island University Hospital. I did a year of radiation oncology, and I did 3 years of physical medicine rehabilitation at State University of New York at Stony Brook. Throughout my medical career, we were trained in the standard allopathic approach to treating our patients, basically medicine or procedures. During my residency, my eyes opened up a little bit to alternative, or what you call integrative or functional medicine. I was at a department where that was actually considered acceptable to talk about and discuss. You see, in medical school, you never learn this approach. Medical school is very, very rigid. So when I was in my residency, I was allowed to explore alternative and integrative and functional medicine a little bit more.
Why is that in medical school that integrative functional approach is just missed in the curriculum?
It's just basically the way they do things. They for example, and we'll talk about this a little bit later as to why functional medicine has a very different approach in actual diseases or actual issues. But everything's a quick fix. You know, you got depression, you take an antidepressant. You got a headache, you take a Tylenol. The approach has been this way for many years, and they just continue doing this particular approach. They're not open to other approaches. They're not open to outside-the-box thinking. Now, for most problems, it's pretty much okay. I mean, for the simple problems or the super severe problems, many times that's okay. But for our chronic diseases, for our diabetes, for our cholesterol, for our chronic pain, this is not working. And, you know, this is an approach I think we need to look at. After I finished my residency program, I actually got a job working at an integrative medical practice. I slowly learned. I took courses, and
was
I
that
saw
just
the light.
kind of random that you stumbled upon there? And then...
That was coincidence, pure coincidence. I finished my residency. I was looking for work. They needed a doctor. I started there once a week, advanced to twice a week. I saw some of the work that they were doing. It impressed me because it was a very outside the box approach, and I started to take more courses. I started to learn more about it, and the rest is history.
Interesting. So for you, would you say your focus has now become these chronic type diseases, the diabetes, fibromyalgia, hormonal issues? That's pretty much your bread and butter?
Absolutely. That's what I do mostly here at my clinic. I treat just about anything that can be considered a chronic disease or a chronic issue. And these include things like chronic fatigue, fibromyalgia, things like Crohn's disease, multiple sclerosis, hormone issues. For females, I do a lot of work with PMS and PCOS and hormone replacement. So yeah, I do a lot of that work, and we look at a functional medicine approach. Now, what do I mean by that? I mean, we get to the root cause of the problem. We just don't put a Band-Aid on it. I mentioned the example earlier of taking antidepressant to treat depression. Well, the cause of depression is not a lack of antidepressive medication.
Right.
There are many root causes of depression. One has to look at each and every one of them. It could be low testosterone, low thyroid, low vitamin and minerals. So you have to look at all those issues, address them, and see if they improve the depression. But at least you're addressing the root cause and not just putting a patch on things.